So today we are excited to welcome Dr. David Margolius. Dr. Margolius had a long-term goal of working in public health or policy to help change the built environment when he was sworn in 2 years ago on August 1st, 2022 as Director of Public Health for the City of Cleveland. It brought alignment of his goals and work. Throughout his career, he has been invested in primary care and the primary care system, describing primary care as the most important part of the system to impact the health of the community. He went to San Francisco to study with people who were researching best models in primary care before coming back to Cleveland to work at Metro Health, serving as Division Director of General Internal Medicine. He has brought extensive experience along with a deep understanding of the impact of Cleveland's social determinants of health. In addition to his role with the city, David is an active educator, serving as adjunct associate professor in the School of Medicine at Case Western Reserve University, and was faculty co-lead for the Medical Director Leadership Institute at Harvard Medical School's Center for Primary Care. He is also a graduate of our Cleveland Bridge Builders class of 2019. As Public Health Director, he has shined a spotlight on the issue of smoking in our community and is here today to help us understand this issue as well as share more about what the Public Health Department is doing to lower rates. Please welcome Dr. David Margolius.
Thanks so much, Rachel. I'm so honored to be here, honored to be a part of this alumni network. Can't speak highly enough about the Bridge Builders program and the opportunities that presented me with. And I think, like a lot of folks who do Leadership Cleveland or Bridge Builders, sometimes, unfortunately, like you find the next thing through those relationships and partnerships. But, employers, you should all continue to fund your employees doing these programs. But that's not the only reason, that the city came calling. So, yeah, happy to be here. I do have slides. I was just only minutes ago remembered that last year when I gave this presentation, I think I went a cappella without slides, but I've got some great slides, so I'm gonna share them with you, and there will be lots of time for good discussion. So let's see. Share. All right, we good? Everybody can see the slides. All right, and thank you for being on camera, those who can. If you can't, I totally understand. As long as there are like three faces I can look at, it's super helpful to know if any of the material's landing, All right. So I always start with a little bit about me. So I apologize if you've seen this slide before, but I was born in Cleveland, grew up in Shaker Heights. That's me on the top left. Early development and checking myself out in the mirror when I had hair. And then speaking of hair, you can see me down below when I was a internal medicine resident saving lives in San Francisco. I then had an incredible 7 years at the Metro Health system, including 2 years that were incredibly difficult for all of us working through the COVID pandemic. And there we are, me and my colleague, my, I don't know, 2-year-old at the time or 1-year-old, I can't remember at the time, running the COVID hotline, which was available to all in the region to get free COVID advice, eventually testing, and eventually treatment. And then on August 1st, 2022, I was sworn in to this role to be Director of Public Health for the City of Cleveland, and the first physician in the role since 1980, which wasn't a requirement, but definitely felt special. This is what the department looks like, and you'll have these slides or this recording so you can dig deep into the org chart. But I think I don't want to ever miss an opportunity to talk about all the different work that happens at the Cleveland Department of Public Health, because folks don't always know what happens in public health. There are 130 of us currently, with 10 to 20 on the way to join our team. We do everything from air quality for the entire county to our lead poisoning program, where we reach out to families affected by lead poisoning, to running clinics, reproductive health care, epidemiologists, community health programs, food safety for all the restaurants and grocery stores in the city of Cleveland, and one of the largest infant vitality programs in the city called Mom's First program, which is a home visitation program with community health workers. So that's the kind of the what. what the department looks like. But this is what we're all about in terms of the challenge and the work ahead. So in the city of Cleveland, we know that the life expectancy for our residents is on average 20 years shorter than life expectancy for residents in the inner ring suburbs. And the reason for that is racism. It's structural racism and it's interpersonal racism. And I think it's just always really important to highlight because um, unfortunately, in a lot of our healthcare fields, we're taught that it could be race. You know, there might be some genetic differences between the races that causes people who are Black or Latino to die earlier or not respond to the same medicines, and that's all been debunked. I mean, that's just wrong. It really truly is the systems of oppression like structural racism that causes this persistent gap in life expectancy between people who are Black, people who are white, and other marginalized, historically marginalized demographics. So the main contributor, the two main contributors to that life expectancy gap are number one, the wealth gap, and number two, segregation. So the wealth gap. Over that time period that you saw with no shrinking of life expectancy gap, the same thing has happened for a wealth gap. So for every 12 cents or for every dollar white family has in wealth, Black family on average has 12 cents. And that gap has persisted and not closed over the last 40 years and comes from starting with the original sin of slavery 400 years ago, but all the way through Jim Crow laws, redlining, which is really well known in Cleveland and well understood, I think, in our city, discrimination, interpersonal discrimination, and people not getting the same access to jobs, state-sanctioned violence, GI Bill benefits going to returning veterans who were white, but being held back from returning veterans who were Black, and so many more things that continue through this day. And so wealth gap, I mentioned, now segregation. As part of the New Deal, there was an emphasis made on redevelopment of neighborhoods and favorable mortgages. Unfortunately, as they made those maps to determine where mortgages went, they labeled certain neighborhoods that had predominantly Black populations, they labeled those neighborhoods red. And they said that no, if you're trying to get money to improve your home in those predominantly Black neighborhoods, that was too risky and you couldn't get as much money, or the interest rates were out of control, or the loan was denied altogether. And so those two forces, segregation and wealth gap, are what contribute to neighborhoods in the city of Cleveland and other cities across the country taking decades off of people's lives. And so I start there when I talk about smoking, because smoking and Cleveland's smoking rate is a direct result of these same forces. And so Cleveland's smoking rate, as hopefully some of you have heard, is one of the highest in the country at 35%. The rest of the country's smoking average is down to 11%. 20 years ago, the country's smoking rate was 20%. Cleveland's smoking rate 20 years ago was 30%. And so while the rest of the country's smoking rate has declined, ours has only gone up or remained stable. And smoking is the number one preventable cause of death, disease, and disability in the country, in the United States, according to the CDC. So why Cleveland? Why is Cleveland's smoking rate so high? Well, it's not by accident. In the 1970s, it became illegal to advertise cigarettes on television and radio. And since that point, the smoking rate across the country has started to decline. People, knew smoking was bad, but then it became kind of more and more mainstream. Folks knew smoking was bad. Doctors were no longer appearing in cigarette ads advertising, the health benefits of smoking, et cetera. And so tobacco executives, much like the bank executives that made those redlining maps got in a room and said, all right, where are we going to find new customers? And they decided they were going to target the youth. They were going to target people in poverty, and they were going to target Black and other historically marginalized races. And so specifically in those documents, which are all publicly available now, thanks to the Master Settlement Agreement against Big Tobacco from 1998, they said, we're going to go to Cleveland, we're going to go to St. Louis, we're going to go to Detroit, and we're going to give away free menthol cigarettes to Black residents of those cities. And as you can see, you've all seen these advertisements over time, but there was a very intentional targeting campaign towards Black residents to ensure that there was a growing customer base for nicotine products. And Cleveland has been at the heart of that. And so while we saw this declining smoking rate across the rest of the country and the quote unquote mainstream population, Cleveland's smoking rate we've been left behind, and Cleveland continues to suffer. And that is why one of the main reasons that Cleveland's life expectancy in our residents is so much shorter than those of our peer cities and those of the inner ring suburbs. To further make this point, our Big Cities Health Coalition, which is all the health departments of all the 35 biggest cities in the country, plus Cleveland, because we've been legacied in, compares health outcomes from all these different cities. And in 2021, we had the highest rate of deaths from lung cancer compared to peer cities across the country. And so it's not just that our smoking rate is high, we're feeling the consequences of that smoking rate. So that's what brings us here today. As I was interviewing for the job of Cleveland Department of Public Health Director, I in my interview said to the mayor, smoking is something that we just have not talked about enough as a city, as a community. People don't know this history of racial targeting, of structural racism, and how it directly links to our smoking rates today. And we need to get behind this movement and build a coalition to let folks know and then do something about it so that we can save lives in the city of Cleveland. So we've been out there, and hopefully you've seen our work. Hopefully this is not the first time you've heard about this topic in Cleveland and smoking. That's why you sign up for this today. I'm really proud of the coalition that we built and how we've gotten the word out on smoking. I think, unfortunately, a lot of folks had assumed that smoking was a problem of the past after the 1998 Master Settlement Agreement. Okay, I know fewer and fewer people who smoke. But in Cleveland, the problem certainly persists, and we've been getting the word out with bus ads and flyers and bus shelter ads and presentations. This is Prince Pempton from our team. We've sold out City Hall with big events with faith leaders. We've been on the radio. We've been on television to help to get out the word. And we really wanted to put our money where our mouth was, and so we've dedicated members of our team and brought on new members of our team to help people quit smoking. And so I think we're up to 4 members of our staff who are trained smoking cessation facilitators. And there are just countless programs throughout the community that weren't necessarily all communicating with each other prior to this coalition that offer smoking cessation resources. And so if you hit the QR code there, you'll see all those resources. 211, I think, is the easiest number to remember to get directly connected to the smoking cessation hotline. And then, of course, our program, our own folks here run programs to help people quit smoking that have been, as of this morning, very successful with our first graduates. But at the end of the day, it's just we've been attacked by these tobacco companies and tobacco retailers. If you look at this map, each dot represents a tobacco retailer in the city of Cleveland, and a red dot is a tobacco retailer within 2 blocks of a school. This is unique to Cleveland. If you pull up these same maps in some of our peer cities, there aren't as many tobacco retailers and they aren't as close to schools. You can see as well the types of products they're selling, the advertisements all over stores, all over the street now. You've seen these cardboard cutouts kind of like all over gas stations. And so for the last year and a half or so, we've been working on a number of policies to either prevent the sale of flavored tobacco products, um, restrict zoning, restricted the number of tobacco retailers, and now we're looking at also restricting advertising outside of the tobacco retailers' stores. All things that other cities are doing all over the country, and we're falling behind. Last point on policy is tax policy. So this has become a really hot issue right now in Cleveland. You all have the chance to weigh in on this. And I won't tell you how to side one way or another because it's against the law for me to do so. But I want you to have the facts on the issue. So it turns out that taxing cigarettes is the single best intervention to reduce our smoking rate and improve the health in our community through reducing our smoking rate. And so Ohio has one of the, you can see the bottom half of tax rates throughout the country. States that have higher tax rates have lower rates of smoking due to those higher tax rates. And since those tax rates got higher in comparison counties in Pennsylvania and New York, Ashtabula and Chautauqua, respectively, you see the change in life expectancy demonstrated by those graphs. It's from a Washington Post article from earlier this year. And so taxing cigarettes helps people quit smoking. The higher the tax, the more people will be likely to quit. And so my last slide, because I've gone past my allotted time for Q&A, is just turning it back to this group of folks who've signed on today. What can you do about it? And so I'll pause there and open for questions.
David, thank you so much. What has the response been so far from the communities where you are targeting the campaign? What's their response? What are they thinking? Are they buying into it?
Yeah, so I guess, hold on, I'm gonna stop. Did I stop share? Are we stop share? No, I didn't stop share yet. There we go. Okay, thanks. Yeah, so when we've spoken to community members, it starts with hesitation, and by the end, it seems like honestly widespread support. And we've got over 100 now community partners signed on to this coalition, the campaign to end tobacco targeting in Cleveland. I think most of the partners on this call, probably your organization has already signed on to that letter. But you can Google Cleveland Ends or Cleveland Campaign to End Tobacco Targeting to get on the website and see if your agency is signed on. So folks have been really responsive. The resistance has come from the tobacco retailers who are worried about losing money to their peers in the inner ring suburbs. And our data has shown that has not been the case in other cities. Sure, maybe a little bit of money, but people end up buying other things. And certainly there are going to be residents who continue to drive as far as possible to get flavored tobacco products. But we know that most people who smoke want to quit. And so just that added barrier, that added additional travel time will help some people quit.
How do you anticipate the now enacted legalization of marijuana access in the state to impact smoking rates?
Sure. Yeah. And folks will ask, like, how can you support legalization, decriminalization of marijuana and, work to restrict the sales of certain products of cigarettes? And so we've tried to be really clear on this, that the sale of marijuana should be regulated. People shouldn't be able to sell flavored marijuana products. People should not be able to sell targeted towards students right outside schools. And we feel like that's the exact same thing for all nicotine products. So what state legislature is talking about for regulating the sale of marijuana is exactly what we're trying to do for cigarettes. So it's one and the same. Puff per puff, cigarettes are much more dangerous than marijuana. But certainly this is new territory for Ohio in the legalization of marijuana. But in general, we want both to be well regulated by health departments.
And what has the response by political leaders in the communities you're targeting been?
I will say to keep myself out of trouble, Councilwoman Meredith Turner has been an incredible champion on this issue. She's a county council person. She's held a number of events with us. The challenge is that there really isn't a legal framework to pass a countywide law here. It's got to be jurisdiction by jurisdiction. And so she's been a champion for us. Councilman Chris Harsh has spoken up in favor of this. Councilman Kerry McCormick has spoken in favor of this, and there are a few others who have been a little bit less public about their support. But there's some support there, but work to do.
And as we think about the tax that would be on cigarettes, what actually is the current cost of a pack of cigarettes these days?
Yeah, so it's in New York, it's up to $10 a pack, and here it's closer to 6 or 7. Minneapolis just passed a law that the minimum price per pack would be $15 in Minneapolis. And what they've done in a creative way to get that to the finish line was they took the excess money that pack would cost and gave it right to the tobacco retailers. Say, hey, we know a lot of people are going to quit because of this $15 minimum, but you can have all the money. Because frankly, people ask me, I don't care where the money goes, as long as the tax is higher and higher, that will help people quit.
Looking at smoking and kind of the addiction to smoking, does that type of addiction then feed other potential addictions?
Nicotine is uniquely addictive. I've talked to folks who have has suffered from addiction to cocaine, to opioids, and consistently they'll tell me that the addiction to nicotine has been the hardest one to overcome, and that's just because of the number of nicotine receptors that upregulate, that increase in your brain, and that's specifically why we've been working on the flavored products, not only the racial targeting history of the menthol cigarette, but unfortunately, due to the nature of menthol, folks who are smoking menthols breathe deeper and more frequently, and so get more nicotine into their blood compared to regular cigarettes that just taste like tobacco, where you end up coughing, more than you're breathing. But menthol suppresses the cough reflex somewhat, and so people breathe that nicotine deeper.
You mentioned connecting folks to smoking cessation programs. What might a program entail to help someone decrease and quit smoking?
So yeah, there are a number of different ways to quit, and most people who smoke do want to quit. Um, but where we work with folks, on where they're at and what they think will work with them. So if it's a matter of I need something to do during my breaks, or I get so much relaxation from those deep breaths that I take when I walk outside to have a cigarette, or if it's, truly like I wake up craving nicotine and then it's more around I need some kind of nicotine replacement treatment to help wean off the nicotine craving. So it's really dependent on the person. Our particular model in the health department is a peer support model. So we do these group classes, and so that people can kind of cheer each other along.
For the collaborators in the campaign, do you see many employers as part of those collaborators encouraging employees to cut back and quit?
The employers have been less at the table than I would like. As I mentioned earlier, smoking is the leading preventable cause of disability in the country. So we could extrapolate that it's probably a leading cause, at least, of disability in our own region, preventing many people from being able to, join the workforce, and probably raising healthcare costs and health insurance costs for their employees. And so I would love to see more from the employers in this effort. I will say that when staffing shortages were really hurting our healthcare systems, in the aftermath of the worst parts of COVID. Cleveland Clinic and Metro and UH, I think maybe had already done it, but they used to prevent current smokers from applying for their jobs and becoming jobs. When I started at Metro, I peed in a cup to prove that I didn't have nicotine in the urine. And they walked back from that policy. And they called me, all your employers, right? They called me to apologize. I said, look, we're so sorry. And I said, no. I would rather you employ people who smoke cigarettes and give them the opportunities to quit rather than blocking them out. So I'm actually very supportive of the healthcare systems hiring people who smoke cigarettes so that they can give them the resources they need to help quit.
As you look ahead, what metrics are you using and keeping track of to determine the success of the campaign? And how long might it take to hit some of those markers where you would consider the campaign being successful?
Yeah, the North Star for me is our smoking rate. The true North Star is our life expectancy and quality of life, and for residents in the city of Cleveland. But the North Star of this campaign is our smoking rate, and that is hard to measure. It involves a lot of money and a lot of surveys. We're hoping to do in coming months. We're hoping to raise some of that money. Maybe some of you can help to be able to do that survey to get the latest data. But in the meantime, we're counting how many people are involved in these events, how many people we've reached through outreach, how many political leaders we've gotten on our side to, help act in the face of our high smoking rate. And how many people are just aware of this history and the why and what's going on with smoking in Cleveland. And so I feel really good about where we are in a lot of those metrics. There's more work to do, but we've come a long way.
So, beyond the smoking campaign, what are some of the other issues that are on your radar as you look across the Cleveland community in the public health space?
Well, there are a few, believe it or not. So smoking is tied for number one with probably six or seven at this point. But the other major issues that affect health of Clevelanders, all stemming from structural racism, are lead poisoning. Our lead poisoning rate continues to be um, higher than any part of the country, twice as high as Flint, Michigan ever was. And so, same kind of effect has happened with lead poisoning, where I think a lot of folks have said, "Oh, 2019, we raised all that money, we did all the laws, we did it, we're done." But that's very far from the case, and so we've got to stay active on lead poisoning. Deaths from opioid overdoses, so 300 a year in the city of Cleveland. People are dying from drug overdoses, and you'll rarely ever see any coverage of that, even though our drug overdose rate is twice as high as our homicide rate, for example. But violence and homicides is another one of the six or seven priorities. Black infant mortality and Black maternal mortality is another issue. Traffic fatalities is something that we're working as an all of government approach to reduce speeds and fatalities and serious accidents in the city of Cleveland. There are a number of different interventions. And food justice. So working to support local food systems so that our residents aren't dependent on places like Family Dollar for sustenance.
And as you look broadly at the health department and the work that you and your team are doing, how can those of us on the call in the community best support your work?
So I think number one is spread the word, please. Um, I recognize that folks have not always had positive feelings about the Cleveland Department of Public Health. We want to change your minds, change your hearts. We want to be the most responsive, most trusted, most impactful health department in the country. And we're not there yet, but that's our aspiration. That's the direction that we're headed. And so please spread the word. And number two, I think just, if you have people in your life who smoke, offer them support. They want to quit. Most people want to quit. And so offer them support so they can help quit. And then number three, be in touch if you have ideas or, different projects that you want to get together on, as many of you already have. And so I definitely appreciate that collaboration.
Well, Dave, we are so thankful for the work you and your team are doing here and look forward to seeing those long-term successes as the campaign continues on and hopefully impacts the health of Greater Cleveland.
Thank you, Rachel. And thanks all
And
for joining today.